You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, what my first guest calls full mouth reconstruction. He says that your teeth and gums are never too bad to have the smile you've always wanted. With us, we have Dr. Dave Rice. Dr. Rice, welcome to the program.
Thank you.
Now, you brought a lot of photos.
I did.
And, I peeked at them in the green room, and they are extreme. I mean, so if people want to take a look at these photos, I mean, they are dramatic. But for people that don't know your practice, like who's the typical, as you call it, a full mouth reconstruction? Who's the typical patient?
Well, we have people that their teeth are just horrible and breaking it down. I mean, people coming in with bad breath and loose teeth, moving teeth, flaring teeth that they're bleeding. They're bleeding when they brush their teeth. They're bleeding when they eat, even sometimes.
Really?
Yeah. I mean, it's incredible what people will suffer through. And then we have people that their teeth are just breaking, cracking. They chew something, a piece of tooth comes off. So we can really help those people. And then we have patients that they come in and they have dentures, and the dentures are floating around. They have to excuse themselves when they're in the middle of eating to go clean stuff out from under there. And they can't taste so much because they have a whole piece of plastic covering the roof of their mouth. So what we do for those people is we're able to give them upper and lower teeth that are fixed that do not come out. It's great.
So at your center, for people that don't know, I guess you have this concept of you do everything yourself under one roof without sending them out to specialists.
Yeah, I've been so incredibly blessed. I mean, I've taken training all over the world just to try to learn how to do sedation, how to do grafting, how to do implants, how to do smile design. And be able to do all that, sometimes you'd have to go to 3 or 4 people, and then trying to get the communication to try to get those specialists to talk to each other so that they're all on the same page. Sometimes things get lost in the shuffle.
So for example, like a root canal. Typically, I guess an endodontist does that, but that's something you do.
Correct. But we also, we refer out also for difficult cases for root canals, but we can do them in-house. So we have great specialists in our area, people that I use on occasion, that they've had special training and they're good at
like the oral surgeons, the periodontists.
Yeah, and endodontists, periodontists, oral surgeons. They're all great to have in my back pocket. But it's great to be able to also have those skills in-house if I decide that it's best interest of the patient to control everything in-house.
Now, one of the things I learned, I guess you do IV sedation, and I guess probably less than 5% of all general dentists in America have this certification.
Right.
Tell me about that. How safe is it?
I think it's one of the safest things, because guys that do pills, you can't control. For me, when I have a line in, and I can control meds right through the line. I mean, the first thing that happens if you're in an accident, you go to the ER, they start a line. And the guys with oral sedation, they don't even know how to start a line sometimes.
So you can't pull them out of it as quickly, whereas a sedation you can.
Correct. With IV sedation, I can do reversal agents right away. If something starts to go wrong, it's incredibly safe. So the medications we use are some of the safest ever. It's incredible when you call people the next day or that day and they don't even remember being there. And then we monitor them through the whole thing. I mean, it's safe.
Like blood pressure, oxygen?
We do blood pressure. Those are for sure given. But in addition to that, capnography is something that it measures like how much CO2 is coming out. So that is also a great adjunct. But you're right, blood pressure, heart rate, SpO2, which is like how much oxygen there is in the blood.
Okay. Now, one of the things you say about sedation is you could do 6 months of dentistry, and I'm paraphrasing slightly, in just one visit. What do you mean by that?
Correct. I mean, time is a big issue because pain, time, and money are the big 3 in dentistry. They keep people away. It prevents people from getting the care that they want. So you have a mother of 3, she doesn't have time to come multiple visits because you have to figure the travel time, the time they wait in the waiting room, the shots, getting them ready for the shot. It's like, so we can do we can do months worth of dentistry in just one visit.
So like 3 hours, because you can't hold your mouth open for 3 hours, but if you're sedated, you could relax for 3 hours.
It's incredible when you're relaxed it's incredible what you can get done in 3 hours with people because they're totally relaxed. You don't even know you're there. And it's almost like you have this out-of-body experience where you're getting everything done. You wake up, it's like, you're done already? So
and they were there, and it seems like 10 minutes to them, but they might have been there a long time.
They don't even know they've been there. They don't even remember coming in the door, some of them. Because we start with oral sedation before they even come in the door. So some people don't even remember from us greeting them at the door.
Okay.
And they're able to walk and talk, and they look like...
So they're numb first, obviously. You numb them up,
for sure.
And then you do the sedation.
Yes.
It's nice.
Yeah. It's a great service.
Now, full mouth, for people just tuning in, we're talking about extreme smile makeovers. And I said at the top of the show, no matter how bad your teeth and gums are, there's still hope to have the smile you've always wanted. Do you believe that?
I do, for sure. There's always something you can do. We can always come up with some kind of option to help you.
Okay.
I mean, and that's the thing. Everybody's looking for an advocate. And so you need to trust your provider, because the plastic surgeons know that for sure. They make you pay for plastic surgery before you even get done, because they want you to trust the fact that what they did, because you look horrible after plastic surgery, right?
Immediately,
yeah.
Right.
And you have to trust that you're going through this, it's going to get better, so you don't want to think, oh, did I pay for it? No, you already paid for it, so now you have to believe the money you paid is going to work out.
You're big on saving people's money. And I'm not just, and people need to know, I'm not trying to side with you.
Yeah.
But you said, I'm kind of like, I look, depending on their budget, I really try to.
Right. We always look for what is the least necessary, not the most possible. Because it's written on the walls. It's like, no, we can always upsell people. We can try to match what they want with what they can afford. And some people can afford a lot, some people can't. And we don't try to not make them feel bad about it. We always say, if this service is going to actually create a hardship for you, we don't want you to do it.
That's nice.
And so, because
you mean that, I think.
Well, what happens is people come in and they get embarrassed. It's incredible how shameful it can be. First, they're ashamed because they have bad teeth, and so they're embarrassed to even show us their teeth.
Even in the dental office?
Even in the dental office. You wouldn't, because you don't see them, Randy. I mean, you don't see these broken down things because people hide it.
Oh, they never smile.
They don't smile. They put their hand up. It's like, you don't see it. We see it all the time. And so they have to have this level of safety with us that they can show us everything. It's incredible. Even when we're doing like a huge makeover, we have to coach people to smile because they won't even show us what they, and it's critical for us to know exactly what they're going to show. Because if they don't show it, and then all of a sudden they get a good, they're happy with their teeth and they show it, they can show something we didn't expect them to show, and then it looks bad.
Okay.
So we have
so you have to teach them to smile.
We do.
Then you say they're smiling all over town.
They are. It's so fun. It's like, it is
so let's go
fun.
to your photos, because this is a pretty dramatic before and after here.
Lana came to us and her teeth were broken down. She found us all. She said, I asked her how she found us. She said, I Googled you. You were like a rock star. I'm like,
okay,
holy
that's
smokes.
nice.
It was really a compliment to me. So she came in and she said, what can we do? And so we gave her options because she had some broken down, especially her top teeth, but her bottom teeth, she wanted to keep her bottom teeth, and we were able to do a
Was she insecure about the smile? Like, did they tell you this?
Oh, man.
Like, I never smile kind of a thing?
She did. She said, nobody knows what my teeth look like. So I was one of the first to see what her teeth looked like, because she smiled for me. We made her smile. And so her teeth were breaking down. They're painful. She had gum problems around there. Her teeth were in such bad shape that we needed help. We didn't have a choice but to do a combination procedure to give her something fixed on top. So our options were possibly to do a denture, but not in my office. I looked at her. I looked at what she had, and the first thing I was like, we have to coach you how to take better care of your teeth. So we cleaned up her gums, and so her gums immediately responded.
You say with a bacterial infection in the mouth.
Right.
That you can brush and floss all day long, it doesn't matter.
No, sometimes it's beyond what you can do yourself, and so you need our help. So first thing we did was we cleaned up her gums, and then I was able to see, oh, this would really help with the combination procedure. So take a look at the after. It's incredible.
It is. I think everybody would agree with that.
Yeah, the transformation of seeing the inner smile, it's coming through. She was tentative in how she would smile, her self-esteem. I mean, you look at that. I mean, Randy, wouldn't you say that a smile makes people more attractive? And in this photo, wouldn't you say that she's more attractive in the after?
Yes, yes.
Yeah.
You know, we talked about that on the phone. You say a smile makes you look more attractive. Well, this is obvious. And that's for everybody, right?
Yeah.
Make a man look more handsome. Doesn't matter.
Well, look at the before. You'll notice the black spaces. You'll notice the broken down teeth. You'll notice the gum display. You'll notice what the teeth look like, how the sharpness is, how they're not even. And when she's at rest, she doesn't show teeth. And it's incredible the transformation that happens with the after. The after, she's got a full smile. Her teeth fill up. They fill up her whole smile. The bottom lip, the teeth match perfectly.
So is that all by design, obviously?
It's incredible the amount of thought that goes into trying to design it, and it's called facially generated treatment planning. And that's what the Coy Center and Frank Spear, those are the guys that kind of started that, and they're really the kind of the fathers of that. So what's happened recently is we've been able to really marry the technology of CT scans, intraoral scans, extraoral scans, put it all within the computer and digitally design everything.
So on a computer, you can plan the smile.
You can plan it with incredible detail. It's like you have a Disney camera that's actually taking things, and the precision that we have now, it's like precision medicine. The old ways that they do it, photogrammetry and 2D photographs, that's impressions, it's all outdated almost. But look at the after one more time. That smile wouldn't work in a man. It's too feminine. The corners are too rounded. The canines are too pointed. There are many things that are customizable for men versus women versus how old you are. The color. I mean, all those are age appropriate.
When a woman like this looks at herself in the mirror for the first time, what's that like?
They usually start crying. It really softens my heart. I mean, she looked at her smile and she told me, "This is better than getting married," and I'm not married yet. I was.
So every once in a while, I mean, you've been doing this a long time, but every once in a while, do you get choked up, or your assistants get choked up?
I do. There's a case that we just did last week, and Jorge, he came in because he had a picture of what he looked like when he was in his 30s, and his teeth weren't serving him, so we had to fix them. And so we gave him something like this, like a combination procedure, and he walked out of there and he started crying. He looked at the picture that he had, that he brought us, and he said, "That's the same guy, but I have gray hair now." So
that's nice.
Yeah, because, and he did. He looked in the mirror, put his head down, and started crying right away. Same thing. You can see how people have shamed themselves over that. They feel bad about it. They hide themselves.
People with bad teeth. We talked about this. People with bad teeth are judged. Can you elaborate on that?
It's, the media has really taken, and the media, for better or for worse, they use it in the movies. They use it in everything. I mean, you look at the villains. How they have dark teeth. They have missing teeth. They have teeth that are crooked. And you're used to that. And so when you look at somebody's teeth, you look at them and you're like, "Oh yeah, I remember in the movie this is the bad guy."
It's true. Like when they like poor people or street homeless people have really bad teeth.
Correct.
And so that's by design, obviously.
It is. And so, what we really try to do is when people feel that way and they want to do something about it, we want to be the people that can help them.
Okay.
And we want to be able to advocate to lead them through this maze of all this crazy things, because there's a million possibilities. So, like I told you, I'm a big diagnostician. So we need to diagnose the problem, because everybody can treat in a million different ways. So there's only one diagnosis. And sometimes people they take the diagnosis. Dentists might take a diagnosis and do a treatment based on a misdiagnosis. And there should only be one diagnosis. So that's another blessing from Morty Amsterdam and John Coyce. It's a truism.
Are these all legends in dentistry?
They are legends.
Because you're big into how the teeth come together to make everything last longer.
Oh, Randy, I could spend months talking to you about how the bite feels, because and people don't care. They just want it to work.
Just get it done.
But I know how to make it work, because I've had problems when I first started in dentistry. I wanted a guy who knew how to do it. He was an orthodontist, so he knew how teeth came together. He was a pillar in the dental field. People knew him from all over the world. And I said, can you fix this tooth? Because I did a full mouth reconstruction and she's having problems now. He looked at me, he said, you don't send me enough ortho. You fix it yourself. And so it started my journey, because then I had to learn it. So it was a blessing to me.
Good for you, good for you.
It was a blessing to me, because then I had to learn it. And so now it's like, oh my gosh, I can't tell you the hundreds of hours I've spent going to different places.
I mean, you were talking about, I mean, you've been, in Europe. I mean, you've been kind of all over the place trying to.
Yeah, Europe, Mexico, Canada.
Is there that much to it?
Oh, and nobody knows the answer. It's like talking about religion. Everybody has an answer, but
so there's a lot to it. Because not all. I mean, some dentists are more of the cavities and bridges and crowns. You're more about these full mouth cases. Anyway, we're short on time.
Okay.
Let's see those photos.
Let me show you this next patient. So, she's a nurse. She's a horrible gagger. She couldn't wear a denture.
Oh wow.
She went to one of the big box stores and they told her she had no bone. So she was devastated, because she knew she literally could not put anything in her mouth. She was a choker. I mean, I couldn't even put a mirror in there without her choking.
Like one of those little mirrors.
Little mirrors. She was like, no. So we had to sedate her to get everything done, did a combination procedure, and she just loves what.
Looks very nice.
Yeah, she just loves.
You say it's not even finished yet.
It's not finished, and she's a nurse, so she knows what happens. In the sedation, we had to change things along the sedation line, so we didn't get done what we wanted to do, and so it's not quite as good as I would like to do, but it's a temporary. So you get 2 sets. So this is our trial set. So she's coming in. We're going to fix it, because I don't like it either. So we're giving her 3 sets. But so for me, she's going to be happy, and that's what we want. You trust me to do something, I'm going to make it right. I know it's not right. Sometimes patients complain to dentists, and they come to me and they say, I told him that it wasn't right, and he said it was right. I'm like, no, it's not right. You're right.
Like if you could feel something wrong.
Right. People don't lie to me. People don't make things up. They don't come to me to complain, making things up. I mean, it's legitimate. And I can't tell you the number of times patients come to me and said, the dentist didn't listen to me. So it's horrible.
Well, good for you. Good for you. What else do we have?
So I want you to look at this one.
Okay.
This is Jane. So Jane came to me, and she was embarrassed for her teeth for years.
Wow.
And
that's unusual?
It's not unusual at all. People, they would rather deal with the fear, with the unknown versus the fear of the unknown. So they know what they have.
So they just never smile, so we never see this.
You don't ever see it.
So it's really that common?
It is very common.
Okay.
It breaks my heart. It breaks my heart that people, feel bad about this. Those sort of things, it holds the patient, it holds her back. It was holding her back. So with the combination procedure, she came to me and she said, she came to me and she said, my kids said this is too expensive. And she said, I don't care. I want to be able to eat and chew and laugh and kiss and be romanticized. She's like, I need to have my teeth back, and I'm retired and I want to enjoy retirement. And so she came in, trusted us to do it, and we were able to get it done for her. And what's so nice, when she's all done, she's like, gosh, why didn't I do this? Why didn't I do this earlier? The regrets people have, it breaks my heart, because she could have. She could have been enjoying this for a long time. But for whatever reason, she decided not to do it. She was afraid.
And you say their personality changes. Like they're smiling all over town, taking selfies for Facebook.
It was amazing. When she first got her teeth, she had to learn how to smile again. And once she started to smile, then she started smiling more. She got positive feedback. People were complimenting her on her teeth and saying what beautiful teeth she has. So it lifted her up. It gave her the confidence to go out there and just to release and not be held down anymore.
What do they like more? The way it looks or all the stuff they could eat and chew?
That's a great question. Some people come to us for looks, and then after we give them the looks, they're like, oh my gosh, this chews better too. Okay. And vice versa. I mean, it comes the other way too. All people come to me and say, I don't care what it looks like, doc. Just get me out of pain. Just fix my teeth. So once we fix it, because believe me, there's form and function. If it looks right, it is right. And so, because you get both.
So some people come in and they just go, look, I just want it to look great, and then they like the chewing.
Oh, yeah.
Or some people, all they want is a pretty smile, but then they love what they could eat.
Correct. Yeah, because they didn't even know what they didn't know. They didn't know they couldn't chew before. They didn't know that, the nuts or the carrots or the, broccoli al dente or whatever. That now it's like they're able to chew that up and be able to really feel like, oh my gosh, now I can be healthier. I brought some of these photos I'd like to share with you. They're from a colleague of mine, Dr. Art Marilas.
Okay.
And it shows you how dramatic it is, what it does for people's self-esteem. So
let's take a look. So these are not your patients, but it's kind of like what? Just an example of how teeth change your appearance.
How people, they change people's lives. It is like you get these teeth, and like you say, it's like the first day of the rest of their life. It's like their life starts over again. And it's so great because they're a different person. I want you to look at the pictures of the before and after. I mean, just look at the guy. Yeah, in one picture, doesn't he look smarter?
It's true. It makes you look more sophisticated.
Right. And people that are smarter, they look like they have more money. They're more prestigious. I mean, people that want to smile, they're more engaging. You feel a connection with them.
It's like charisma comes back.
It is.
As you say.
Yes. Their charisma comes back. It's incredible how that feeling is that you feel an immediate connection with them because they smile. It's something simple, and it's great to be able to do that for them. So I want you to look at this patient. Again, so look at the before and after. It changes her appearance. It's great.
It does. It does.
Here's another one of the patients, and the reason I'm bringing them from Dr. Marilas is because I'm working on the signed consent for my other patients.
Okay.
So the patients that I've done it for. But I can't tell you how many times we do something like this, and all of a sudden men shave their mustache and beard because they were trying to hide their teeth. And here's another one. Another great example of how it transforms people's lives.
He doesn't look too happy in the before.
No, he doesn't. People don't want to smile. They hide things.
Are they really never too gum? I mean, if you have really bad gum disease, you could still do this?
Well, for sure, we'd look at trying to clean up their gums, number one. And if they respond, then we don't have to do this. But if they don't respond, then sometimes there's no choices.
Now, you have a special secret sauce you sent me, right? I haven't used it yet because I wanted you to tell me how to do it today, but that helps clean up this bacterial infection.
Right.
Is that right?
It is. There's, when you go to a surgeon, like you go to a specialist, they're surgeons. And so you have to look at surgical models and medical models. I mean, that's really what we're after. And you go to a surgeon, and that's part of the fear of patients coming in because they're used to you doing surgery. But in medicine, it's not like that. You have your MDs and you have your surgeons. And so when they treat your high blood pressure long enough and it doesn't work, then you have to go get thoracic surgery. So yes, I mean, there's a whole way to treat the disease medically with behavior modification, how to use a toothbrush, special toothpaste, special rinses. And so
it's the special rinse that we talked about on the phone.
Correct.
It kills the bad bugs in your mouth?
It does. And so basically there's bleach, hydroperoxide, and iodine. We know that those things work.
To kill the bacterial infection.
To kill bacterial infections. And so you have to know which one to use, which is more appropriate for the problem that the patient has. Because I can't tell you the thousands of things that come across my desk every day trying to buy this, but most of it's crap.
Now we should mention, by the way, and we'll probably have a minute left, but you are you test out dental products for other doctors before they use them.
Correct.
Of what's good, what's bad.
We do.
How does that help you in your practice for your patients? We only got about a minute.
what's great about being the product advisor for the Koi Center is we get exposed to things before they even hit the market. Okay. And so we're able to evaluate them, and I've been around forever. So I've evaluated millions of products. And
is that why you do things faster than most guys? Because you have all these gadgets and technology and computers?
Well, we have the gadgets that help us.
Okay.
Because you have to be careful of, because I'm a gadget guy, and I'd fill the office with gadgets, but we do have the gadgets that make a difference.
Make it look good. Okay, final message. Somebody's watching this. Like you mentioned, bleeding gums, bad breath, loose teeth. It's a full mouth reconstruction type of a patient. But for whatever reason, they've heard what you have to say, but they're putting it off and still scared. What do you say to them?
I say, we understand. So kick the tires, come on in, just get information. You know, knowledge is power. And so you tell yourself all these stories of why it can't work, what the problems are, but you need somebody to help guide you what the possibilities are. You can't just put your head in the sand and look like an ostrich. Sometimes it's good to get a good advice from a trusted advisor. And
to know your options.
Correct. And so we try to coach you. So there's two things, right? In the bad thing about dentistry is you have two things. You have your guy who's telling you what your problems are, and then the same guy's telling you how to fix them. So sometimes there's a conflict of interest.
Okay,
and
good point.
So you have to separate those two. And so to me, if somebody doesn't want to follow through with my treatment, I give them the treatment plan and say, check me out, fact check me, do your work, get what you need to have done, and make sure that what I'm telling you is true.
So you kind of like to give people the least expensive options,
correct,
like the medium, and then of course to do it the ideal situation.
Correct. I mean, because there's a million ways to treat. There's only one diagnosis, like we said, but there's a million ways to treat. And so
affordable dentistry. That's what you try to do.
Like I said, I'm an advocate for my patients. I don't want them to spend any more money than they have to.
Good. You're also a health guy too.
I am.
Personally. Good for you. Anyway, I want to thank you we're out of time. So they go to your website. Did they get to meet you on the consult?
Yes.
Okay, so you get to meet everybody.
Yeah.
So again, thanks again for coming on the show.
Thank you.
All right. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.